So in this video we're looking at massage of the full leg in supine. So you can see me starting with some long flushing opening strokes there, and then starting on the top of the leg, again still with effleurage, just warming up the area, getting the feel of it.
So what's important to note is that at no point is Tamsin putting any pressure directly down on the knee. The knee is supported by a bolster, but you don't want the pressure to be going directly down top of the knee. The structures above and below, not a problem at all. But anything that's going to put pressure on that knee into hyperextension is an absolute no.
So there I was doing some forearm glide. That would have been quite light and quick because you could, well, because it was quick, it was quite light, and also it's still quite early in the massage. Now I'm doing some cam and spindle, which I've getting a bit deeper.
So really again here, important to note, Tamsin is lunged and using that, as you can see, as she comes forward, to increase the pressure a little bit rather than having to force and bend elbows and push along. So a really good variety of sort of different effleurage techniques. Maintaining contact throughout. So as you then here link into petrissage, there's always a contact with the client, a continual flow, a rhythm that's starting to be developed. Now that in and of itself will increase blood flow, but also increase your client's relaxation. So they start to get familiar with the touch. Again, quads can be quite a sensitive area, I find. Mm-hmm. And so encouraging your client to sort of be involved in the treatment and relax is really important.
There we go, a little bit of picking up, double-handed picking up on the quads, nice and easy, coming right down to the knee and working the way up. So my pressure there, as you can see, is going up in handfuls.
What's also important to note here is how high and how well folded the towel is. So the towel is tucked right into the top of the shorts. Now that exposes as much of the muscle as possible so that you can work, as Tamsin says, right from the knee all the way up to the hip.
That was a little bit there of butterfly as well, just around the knee, so the tissue's just above the knee. So that was double thumb butterfly, and then flushing straight through after a little bit of deep work. I didn't spend too long doing that, as you can see, but plenty of flushing through after.
Yeah, so again, it's all about mixing it up. A little bit of sort of much more intense work, more targeted work, combine them with flushing it through.
So now on to full length of the leg again to give it a good flush through. Nice long effleurage strokes. You can see me rocking back and forth on my legs rather than trying to overstretch. And then we start on the lower leg. So again, effleurage to the localized area first. And then single thumb, some little bit of single thumb work there, and that's fine because the pressure is going to be very minimal because you really can't get that much pressure in at that angle.
Now this is quite a difficult area to treat, namely because the tibia is so exposed as a bone, it's right painful on the surface. So when you're putting your pressure on, you need to be off to the sides of that, more commonly on the lateral side where we're looking at the tibialis anterior as the most exposed muscle on the sort of on the anterior aspect of the lower limb. So you can see that Tamsin's ever so slightly changed her angle, a little bit more diagonal so that she can go onto the side rather than directly down on the top of that muscle to add a little bit more sort of direct force to it and to avoid pressure directly on the tibia.
So my hands do sweep over the tibia, but the pressure isn't really there. It's just kind of a guiding stroke. And then all the way up through, taking the pressure off at the knee.
And that's a really nice sort of couple of examples of linking through for your legs.